This is Bell Let's Talk Day, the yearly event that takes place at the end of January every single year, 11th year for this, and you can help out, and it's like the easiest way to help out by using the hashtag on social media, whatever social media you use, the hashtag Bell Let's Talk. You can send a text or make a phone call on your Bell mobility phone, and that sends 5 cents to mental health initiatives. You could use all sorts of ways. The Bell Let's Talk frame on Facebook and send out a message. There's just so many ways to help. And we're telling you how your money is being used and hearing from people who have been, dealing with mental health issues and some of the people that help these people overcome some of their mental health issues. One of those people is from the Canadian Mental Health Association here in Windsor-Essex, and her name is Whitney Kitchen. She's a community support worker, and she joins us now. Whitney, good morning, and thanks for joining us on this Bell Let's Talk Day.
Hi, thank you. Good morning.
Hi, Whitney. So tell us how you're involved with the Canadian Mental Health Association, and what got you to that point. I understand you had your own issues when you were younger.
Yeah, so I've been connected to Canadian Mental Health. I'm a release from custody support caseworker, so I've been working there since 2014, and I always knew, since I was 13 when I got diagnosed with anxiety and depression, I knew that I wanted to help other people. It took me a while to go through my own journey of mental health and sort through some of the challenges that it brought me, including dropping out of university at one point in time, and many years in counseling and trying different medications, mastering my coping skills in order to get to a place where I could help people. But now I work at Canadian Mental Health full-time, and it really is a privilege to get to help other people with some of the setbacks that really made me feel isolated when I was younger, and, truthfully continue to be something that I have to master taking care of in my personal life.
And how much has your experience in your own life helped you to help others?
I think that it's made me a better worker by far. I really understand the vulnerability that it takes to come in and talk to another person and how important it is for that worker to be present. I recognize signs of struggle in different ways because intuitively I have my own experiences. And as a result of having my own experiences, like people in my personal life, whether it be friends or family members, reach out to me for support because they know that I get it on a personal and professional level. So that's given me a lot of different insights into what it looks like to experience mental health concerns and the type of compassion that people need when they're going through those issues and being vulnerable, sharing those experiences.
And do you deal with helping others with mental illness in your situation, in your position as a social worker on the release from custody team? What is that exactly?
Yeah, so I work with people that are in largely the Southwest Detention Center and try and help them get connected to supports when they're getting released from custody. So, the jail system is one of the largest homes for people with mental health conditions. The hospital only has so much capacity, and our shelter systems and incarceration pathways have become large houses of people with mental health. So my job is to help acclimate them to the community when they get released, connect them with probation, talk about their symptoms, talk about addiction, housing, coping skills, all of those things. So, yeah, I work a caseload every day with people who have different challenges with mental health. And a lot of their challenges are different than my own, but I think the same vulnerability and sometimes the scary experience that can come with some of your symptoms really resonates. So it's been a blessing to work in this field.
All right. Well, Whitney, thanks so much for your time this morning. Whitney Kitchen,
Thanks,
community
Whitney.
support worker from CMHA. And, I think there's a lot of different services and programs out there like the one Whitney's involved with that maybe people don't even realize that there is help here, right here in Windsor-Essex, that CMHA has some great services that people can check out, adult bereavement programs, and I'm involved in their golf tournament every year as the MC, and they really focus on that bereavement program for parents who have lost children.
Yeah.
And that's just an example of just one of many programs they have over at CMHA Windsor-Essex.
Well, yeah, and that's really all part of Bell Let's Talk Day today, and that is encouraging people to reach out and seek out that help. And you're right, Mike. A lot of people may not know what help is available in our community. It just starts with a phone call, or maybe saying to a friend, "Hey, I'm feeling this way. Do you know how I can get help somewhere?" And I hopefully people get the courage to do that.